We just opened the facility for service February 4th, actually. We had a number of open houses just prior to that point in time. It's been a grand welcome from the Valparaiso community in Porter County to St. Mary. But it's a large facility, 55,000 square feet. It's currently a 2-story building. We have the ability to grow to a 3rd story eventually. But that facility services the residents with just a large array of outpatient diagnostic services. So everything from CT, MRI services, 3D mammography. We also do ultrasound, EKGs, echocardiograms, physical therapy at the facility, as well as on-site clinical laboratory services. The facility is based around a number of primary care physicians, family practitioners, and internal medicine, but we also have a large array of specialists in the building because the project was really about creating not only a healing environment that you'll see if you're able to visit the facility, but also making it a one-stop shop for patients. If you've ever been in a position where you've had to navigate the healthcare system, it can become pretty complex. So our notion was in an outpatient setting to bring as many of the specialists together to be able to service the patients at one site. So at that building we have a large OBGYN practice, Innovative Women's Health. We have urology, podiatry, cardiology, neurology, plastic surgery, pulmonology services, general surgery, and bariatric services at the site also. We also wanted to open the doors to the community, so we have 2 large community rooms there. So we've been approached by a number of organizations who would like to use the community rooms. We'll also probably be doing yoga out of the site to really say we are a community-based hospital, and we really mean that. We want to be part of the community, so we're opening our doors to not only business groups, but support groups for medical purposes. We'll also do a lot of continuing medical education at the site, whether it's about childhood obesity, that really is a challenge nationally, diabetes, preventing strokes, also our obstetrical and women's health service lines on why it's so important to have your mammography performed and for you to really participate in any preventive programs that your own health insurance programs or that our hospital offers at intervals. We do a lot of health fairs in the community to really try to provide access to those services that maybe some of the poor or disadvantaged might not otherwise be able to take advantage of. We have a very strong Helping Hands program, so a lot of charity care for those individuals who can't afford their care. We also, for over a year now, had instituted what we call a Quality Care Navigator program. So those specialized nurse navigators actually are doing follow-up phone calls to patients' homes to assist them. So we may be reaching out and affiliating with the Salvation Army to help the patients navigate to get them the resources they need. And we've been in a position to be able to uniquely assist them with some low-cost medications, even through Medicare programs that they might not have been aware of prior to this point in time. We do home visits to patients by our nursing staff to make sure we can keep them comfortably in their home. And those are not services that have a fee or are billed to a patient at all, but it's really about our notion that the patients really would prefer to be in their home versus in a hospital, in a bed. And we also know that the notion of reform, that we really need to reduce the number of readmissions to the hospital. And that means keeping the patients safe, making sure we can get them the medications and the support they need in their home. We have a number of what we would consider ancillary or support service education programs, and that's everything from our nursing staff and our university program affiliates, as well as physical therapy, x-ray, our laboratory services, and we also are affiliated with IUN School of Medicine. So we are now in a position where we're able to take even their third-year students for rotations under the actual guidance and mentorship of our medical staff. So that's been working really well. We have a strong summer program for even individuals who are anticipating they might want to enter the medical field, and that program's been in place here at St. Mary for well over 20 years under the leadership of one of our medical directors for continuing medical education. So we are deeply interested in engaging with the community and the residents of the community to further their healthcare education, because I think we're also a great provider of employment in the community and also offers us an opportunity to keep that wealth of knowledge in our local community. When you come to St. Mary, I think you feel it from the time you walk in the door, that all of our staff and physicians are passionate about the care they provide to the patient. Hearing feedback from the patients and families and receiving letters is probably the most rewarding part of my job, as well as our staff's job, to hear that they feel it when they're here. And it's everyone from the valet service in really being accommodating to our patients, to our food and nutrition staff, our cleaning staff, and even walking down the halls of the hospital, always willing to help to even escort individuals, whether they're the patients or visitors, to their destination here at the hospital. And I think it's just the attitude of the facility that is very caring, and that's what we're here for.